The Alldus podcast is brought to you by Alldus International, supplying your expert AI and digital transformation staffing needs across the US and Europe. Today, you are listening to our AI in Action series, where leading minds in AI from across the world share their story, success, and advice. AI in Action cuts through the hype and explores the true impact of artificial intelligence in our world today.
You're listening to AI in Action. I'm your host, JP Valentine. Our guest today is Mathaeus Dejori. Mathaeus is the Chief Data Scientist at Premier Inc. Mathaeus, welcome to the show.
Thanks, JP. Thanks for having me.
We're delighted to have you. So, Mathaeus, let's start with yourself, please. Can you give us a bit of background on your journey in technology, from where you got started, some of the roles you've held along the way, and take us up to today as the Chief Data Scientist for Premier?
Yeah, I came to technology and data science, I think, rather late and also through an odd angle, which I think is not uncommon to this field. I originally wanted to study music in college, and there I learned about a bachelor's program for audio engineering, I think it was called, and it was this blend of electrical engineering and music theory. And I was familiar with the music theory part, but I was not with the electrical engineering part and also the computer science part. But it was very foreign to me, and at the same time was very intriguing. And so I just switched over to studying electrical engineering 100%. And the first time I then got in touch with, I would say, data science or machine learning, when I was interning at a brain-computer interface lab that used signal processing and machine learning to turn EEG signals, so brain activity signals, and to control a prosthesis in real time. And to your theme about AI in action, this was the first time I saw AI in action. And to this day, I'm always amazed by algorithms that can generalize and that can do something that is completely unexpected. And so when I saw this the first time, it was clear to me that I wanted to stay. Later on, at some point, I joined a machine learning research group at Siemens, where I applied all sorts of machine learning approaches to a variety of different use cases, so starting from clinical diagnostics to predict the onset of breast cancer relapse based on a very small set of biomarkers. And this scaled up to predicting whether a turbine would fail based on hundreds of time series signals. So that was a very broad approach of applying machine learning. It was very research heavy, and I really enjoyed it this time. I worked with a lot of great people who, again, came all from different angles and all worked on the same field, which now we would call data science. But it was also, again, very research focused. 90% of what we did was probably not ready for the market. It never saw the light of a product. And so at some point, I realized I wanted to get closer to building products. And this is made clear to me that I wanted to join a company that is close to product development. And the other thing that I also wanted to do was go more into healthcare, because, and I think you hear this theme over and over again, it's very rewarding to be able to have an impact on somebody's health, or more generally, to make healthcare better, to what I'm excited about, which is machine learning. People who work in healthcare AI, they're very passionate about both things, AI and healthcare. And then before Premier, I joined a startup called Stanson Health, where we built software to nudge providers to do the right thing at the point of care. So essentially, you can think of this as a recommendation system that in real time tells providers, like a doctor or a nurse, what they should do. Okay? So for instance, a physician plans on ordering a high-cost lab test. Our software would in real time look at the patient chart and would then determine whether the test makes sense or doesn't. And if it doesn't, we would nudge the provider to not order it. And we would at the same time also show all the evidence and the reasoning behind. Okay? The same thing you could apply, for instance, to if you want to switch out a CT that includes radiation with an MRI that does not include radiation. So we built all these nudges with the benefit of reducing cost and also improving patients' outcomes. And there was also analytics behind, so we can measure this, we can track this, we can show the end user how much these nudges actually reduce cost and improved outcomes in general. So this is classical CDS, clinical decision support, has been around for a while, actually for decades. In fact, I think expert systems in the early days of AI in the 70s and 80s, they were full of healthcare use cases. And so nothing new from an application perspective, but what differentiated us from others was the use of machine learning to make these nudges more precise and also more impactful. And ultimately, I think in 2018, we got acquired by Premier. And since then, we keep growing the CDS business within that organization.
Amazing. Thank you so much for the background. And it's always great to hear from leaders in the world of data science how their path was non-traditional, because I think that gives some hope and confidence to others who either have not figured out their path yet or have an interest from coming from a different angle. So thank you. So you talked about your desire to move into healthcare, and it started with Stanson, which was then acquired by Premier Inc., who, for people who are not as familiar, Premier Inc. are an industry leader in their field. So can you give us a bit more of an overview of the mission at Premier Inc. and then walk us through your role as the chief data scientist?
So Premier is a healthcare improvement company. And what we do is we use data to optimize all sorts of elements in the healthcare system. And one interesting aspect I find interesting about Premier is that it's partly owned by and governed by healthcare systems. And one of the advantages of that is that we have a very large data footprint, meaning we have access and visibility to a large portion and fraction of the US hospital discharges. I think the number is around 45%. So 45% of all US hospital discharge data flows through our systems. And with so much data, and now you can pair it with machine learning or statistical methods, you can try and tackle all sorts of different things. Okay? And again, you can tackle things that improve healthcare. So for instance, we have groups that develop machine learning models to improve the supply chain. So they forecast how much staffing will a department need, or they forecast drug pricing, or they try to forecast drug shortages. And these supply chain use cases, to me, they are not first to mind when I'm thinking about healthcare IT. But at the same time, if you think about COVID, it is very apparent that guaranteeing the supply chain and of equipment is utmost important. So that's the supply chain part. We have groups that use machine learning to augment and build high quality data sets that can be used for drug discovery or clinical trial selection. Or they can be used by clinical research groups to answer all sorts of research questions. And so, for instance, during the pandemic, the NIH used some of the data to study population characteristics of COVID patients. And they used this data set because, again, of its large footprint that we have that you need if you want to answer pub health questions. Now, the CDS branch, my group in particular, we work on automating all sorts of clinical decision making. And the focus for us is really to go from nudging to automating. So we ask the question of, rather than nudging the provider to do the right thing, can we simply just automatically do the right thing? And going from nudging to automating, there's really two main drivers for this direction. One is that there's just this growing need of automation in healthcare. Healthcare staff is overwhelmed, is overworked, and is also frustrated with their work. There is these statistics that show that a large portion of what clinicians do these days is administrative duties. And so if we can automate some of these parts, we can make healthcare a better place to work. And the other driver for AI is just the advancements that we have there. So machine learning in particular is becoming more and more accurate, more and more powerful. And with this high accuracy, we can automate rather than just nudge.
One thing I'd like to add in there, if you don't mind, is just to highlight, while working on automation and advancements, you guys also have a huge focus on the ethics behind what you do. And Premier has been named as one of the most ethical companies 14 years in a row. So given the sensitivity of your data and the impact, I think that's something that I'd really want to highlight for our audience.
Yes. So I think all these use cases, if you tie them all together, then really what brings them all together is the mission of Premier, which is to improve the health of communities. And when I read this mission statement, it reads like the mission statement of a community hospital, of a hospital that is in your community. And I think that really is a very humbling experience for us, because we use machine learning, but at the same time, we want to have this effect on improving the health of communities in a very respectable and ethical way.
You are listening to the Alldus podcast. When you're looking to scale your team, or if you are interested in showcasing your company in a future episode, reach out today. Or if you're in the market for a new role, visit our website to view open positions, www.alldus.com.
I want to spend some time having you talk to us about the current makeup of the broader AI and data science team. Obviously, with the acquisition of Stanton now Premier, it's merging different divisions. Can you give us some insight into what the current setup is like, how many people are involved, and how you go about coordinating the various projects that exist at any one time?
So JP, in this case, I can talk about the CDS part. I think we have probably a classical setup in the sense we have an engineering team that is focused on the entire engine and on the entire stack. We have a DevOps team that makes sure that everything we do is scalable and at the same time also is HIPAA compliant. We have the data science team. I think the interesting thing of the data science team is that we heavily interact with clinicians to a lot of times just understanding what do we need to do? What are we trying to achieve? So I'm thinking about what are the objectives of the AI team in particular. There's really two objectives that I can see. One is we want to make our products best of class. So we want to make sure that we get feedback from our clients and from our product teams, and we include them, meaning we improve our models. So we try to create new models. And again, if we talk about creating new models, there's a lot of collaboration with our clinical team, with our clinicians. It's very vital for us to understand what the target is. What are we even trying to achieve? And it's also very important to understand where in the workflow do our models fit in. One thing that is very important to us is that we don't interrupt our users, the physicians or the nurses. So the best tech is the tech that no one sees. And so it's very important that we achieve this. And so this is where we work with engineering and DevOps to achieve these operational criteria such as latency, but also invisibility. The other part, in order to make our products best of class, is that we want to make sure that we stay current with AI or machine learning innovation. We see this constantly. That's stuff that we've built 3 years ago is not current anymore. So we have to make sure that we are current and we stay current, and that we know what is cutting edge and what isn't. And if it's not, then we have to critical think about what is the addition that we bring to the table here. And the other part is for the AI team is thinking about how can we make our organization more efficient? How can we make us more efficient? We talk a lot about automation. So we, as an AI team, we think a lot about how can we make sure that deploying models into production is not a big deal. How is retraining and tuning models not a big deal? How can we make sure that we don't use a lot of data, or how can we minimize the need of data? And in general, as we see that we have more and more AI, we have to think about how can we deploy more AI with a constrained compute budget. The more AI we have, the more we accrue cost. We also accrue latency. So we think a lot about things like multitask learning. How can we combine different models together to do multiple tasks at once? And we're also thinking about this dichotomy between models that are not as accurate, but at the same time, they're faster. So there's all these engineering challenges that we have that we constantly think about to make us more efficient.
I'm glad you brought up the topic of the evolution of the technology and making sure it stays current, because that leads nicely into the looking ahead piece. Given your role at the high table, overseeing all the various projects across CDS, when you look ahead for the future of Premier, the future of your group, and the potential impact it can have to the healthcare industry as a whole, what are some of the trends that you expect to see, and what are you particularly excited about that's coming down the line over the next couple of years?
Broadly speaking, the field of clinical decision support is a growing field from a demand perspective. So pre-COVID, CDS and automation were largely seen as should-haves, and now they're seen as must-haves. So I think there's just this growing demand, and maybe caused by this growing demand, there's just this in parallel immense supply of new ideas and approaches. Us aside, I think in general, there's just this ever-growing list of groups and startups and papers and ideas. And it's a very highly active multidisciplinary field where a lot of innovation is emerging. And playing a role in this field and contributing to it, that by itself is very exciting. Okay? So I think from an engineering perspective, obviously, there will be more need for what we do. And I'm very excited about the challenges that we have, to further scale and operationalize what we do. If I think back, for instance, a couple of years back, we have 5 times more models. And in the future, this scale and this growth will just accelerate. So this is one part. The engineering part is just staggering. The other thing is scientifically, from that perspective, I'm very excited about the research that goes on in trying to move away from pure machine learning methods that we currently use to combine them with machine learning, but also domain knowledge to tackle challenges such as bias, transparency, and trust. So if you think back, for instance, 10 years ago, CDS was mostly rules-based, and you have these very meticulously crafted rules and formulas that have been created by domain experts. And a lot of them actually work very well. And now the trend has shifted, and now we are in machine learning land where we collect a lot of data, and we try to basically emulate these rules completely domain agnostics. And it has its total benefits. But at the same time, I think we get to the realization that it's best to merge these two things together, because if we merge them together, again, we can tackle bias, for instance. We can also make this model more transparent, and we can then instill more trust in what we do to the users that then get in touch with these AI systems. And I think the last thing I'm very excited about, just to see how AI will work alongside clinicians. There's a lot that needs to be done in terms of user experience and how we assist clinicians with as little intervention as possible, and to give them all the insights they have about how we use AI and how the AI works.
Final question from me then, Mathaeus. With all that innovation and all of the stuff that you just mentioned that's coming down the line, I'm sure that there's going to be a continued need to grow at Premier. So given the workforce in its current state, anything across data science and engineering, we're at almost zero unemployment. So it's a big challenge for every organization to continue to grow and attract talent. When you're sitting with candidates who are interviewing for a possible role at Premier, what is it that you tell them about the work that you guys do specifically that would get them interested and excited about joining Premier over some of the other great opportunities available to them?
Yeah, that's a good question. So I think, first of all, I would emphasize just the excitement that there is in the field, and also the meaning that you have in this field. Again, if you have a chance to apply and to use cutting edge AI at scale and to improve healthcare, I mean, if you're excited about this, if you're excited about both worlds, then you are actually right in the spot, and you're right there where you want it to be, which is healthcare AI. So this is actually a great spot. I think in terms of what we offer, I think first of all, culture it's a very important thing to me. If I think about team, one thing that you cannot automate is how you build great teams and how you make sure that individuals grow, and how individuals with all their personal goals and dreams and challenges, how we build these high performing teams and how we make sure that everyone feels accomplished and respected. So this is actually something that I'm very keen about, is to build teams and make sure that everyone gets rewarded by what they do. The other thing I would also say is that the interesting aspects of the CDS branch of when we came from Sen, we are a fully remote team. We were a fully remote team before COVID. So if I'm thinking a little bit about our DNA, then I would first of all say we are a very diverse group. We operate on a lot of different locations. We have all sorts of different professional background. And in order to innovate, you need this diversity in this space. And I see this every day, just the interplay that we have between different teams, between AI, machine learning, engineer, and clinician, making compromises. That just is vital and inspiring. The other thing that I will also say is that in terms of startup environment that we have and that we still have instilled, is we are always fully remote, and we put 100% trust into each other. Since we work in different time zones, different places, we are very adaptable and we can get things done very quickly. But at the same time, we respect each other's life outside of work, and we respect boundaries. And so the other aspect I would also emphasize is that we make sure that everyone, again, is heard, and everyone has a voice, and everyone can grow. So I think if someone is new to this field, I will always say, join a group where you can grow, where you have this ability to, one, scale, see healthcare IT at scale, but at the same time, grow and see what is cutting edge and what pleases you.
Mathaeus, thank you so much for coming on today and talking to us. It was great to learn about your own background and the pivot from the interest in the arts world in music to now being a chief data scientist. The work you're doing at Premier is incredible. You guys really are industry leaders, and you're impacting some of the most crucial areas of healthcare. And it's great to hear how AI and automation and machine learning is core to what you do. And it sounds like it's an exciting and fun place to work, which is very supportive of its people, which is exactly what you want to hear. So we wish you, the team, and everyone at Premier the best of luck in the years to come. Thank you so much.
Thanks for having me, JP.
Thanks for listening to this episode of the Alldus podcast. If you enjoyed today's episode, don't forget to subscribe, rate, and review. We are available on Apple Podcasts, Spotify, and any Android podcast of choice. You can also head over to our website, www.alldus.com, to listen to more podcasts, view our open roles, and stay up to date with industry news. Thanks for listening, and stay tuned for more great episodes coming very soon.